Hi, everyone. It's nice to see you. This is Dr. Tidman. Thanks for stopping in and watching another one of my research reviews. I try to make my YouTube channel your go to channel for health and wellness. I try to dive into the powerful role of nutrition in supporting brain health, improving metabolic function, and managing chronic disease. On my channel, I try to focus on evidence based content. Today, I'm going to be reviewing a case study that I conducted on a person with Parkinson's disease. This case study is published, and I hope you benefit from learning about this case study. If so, comment below and be sure to subscribe. Remember that what I share on my channel is for educational and informational purposes only. If you want to make some changes, talk to your medical team. So, I'm going to review my study about this woman that was having trouble with her Parkinson's symptoms. She was in this study for 24 weeks, that's 6 months. I'm going to review her results at baseline, 12 weeks, and 24 weeks. Review my conclusions about the variables that I tested with her, and then, of course, give you my common tips and takeaways at the end. So stick around. So, the person who was enrolled in my study was a 68-year-old female. She had Parkinson's disease stage 1. There are 5 stages. She had a history of anxiety and depression. She was in school trying to complete a degree. She was having some problems with her concentration, her attention, and low energy and fatigue were a big problem. So, the variables I tested, I administered a CESDR depression scale, the Parkinson's disease anxiety scale, and the UPDRS. For those of you who have Parkinson's, you're familiar with this scale, the Unified Parkinson's Disease Rating Scale, which is used by all of your neurologists to test your Parkinson's symptoms. Also, being a metabolic health practitioner, I tested her metabolic markers: triglycerides, HDL, fasting insulin, HbA1c, HSC reactive protein, her weight, her waist measurement, and I calculated a cardiac risk ratio. Her baseline symptoms included a lot of pain, a lot of back pain, which is very common in my patients with Parkinson's. She had occasional disruptions in her sleep. She had some mild motor symptoms in her Parkinson's. She had mild to moderate depression, so her depression score was 42 on the scale that I used. You like to see it below 16, so she was having some problems with depression. She had mild to moderate anxiety, scoring a 23 out of 48 on her Parkinson's anxiety scale. She had some poor blood glucose control. Her A1C was in the diabetic range, so that means it was above 6.5. I believe she started out at 7.3. She had obesity. Her BMI was 35.8, and she ate mostly processed foods and sugar. She had some mild hypertension. So I had her test her glucose and ketones every day. You've heard me talk about this. We were in email communication, had meetings on Zoom for education and questions. She was tracking her diet using the MyFitnessPal app. Very good app. You can get the free version, and it has the largest database of brand name foods in the world. I provided her with a cookbook and some sample menu plans, and then I took her labs at baseline, 12 weeks, and 24 weeks, along with the surveys. Her ketogenic diet intervention, she consumed fats up to 70% of her daily intake, which included MCT oil, olive oil, lard, butter, some limited dairy, some high fat dairy. Her proteins, she kept about 25%, meat, fish, poultry, and eggs. And her carbohydrates, she kept below 5%, green vegetables with occasional berries. Her daily ketones and glucose, I wanted her glucose to stay below 100 millimoles and her ketones above 0.5. So those were the goals that I set for her. The results. So I compiled the results into a table so you could see the baseline, 12 weeks, and 24 weeks results. As you can see, she had a lot of improvements. Her depression scale scores dropped, which means she was less feeling depression symptoms at the 24-week mark. Her anxiety scale scores also dropped. Her UPDRS scores had an increase, and so this was difficult to sort out. Her symptoms, kind of progressed a little bit during the study period. Her triglycerides dropped 69 points, which I don't believe I've seen that kind of drop in triglycerides in 6 months. So this was a considerable improvement on a metabolic health marker. Her HDL increased, which is what we want to see. Her inflammatory markers decreased by quite a bit, 0.65 points over the 24 weeks. Her fasting insulin was another tremendous improvement. It dropped 13 points down to almost the normal range in 24 weeks. Her HbA1c went from the diabetic range to the normal range in 24 weeks. Her cardiac risk ratio dropped to practically 1.0 from 2.88. So her risk of having a cardiac event improved to the normal range. And she lost 29 pounds, almost 30 pounds in 6 months. Her waist circumference, she lost 6 inches off her waist. And we know that waist measurement tells us a lot about the damaging fat that you store around your waistline. So she improved considerably. Her quality of life statements at the end of the study, she reported that she could now resume taking some classes. She felt more energy and became more active during the day than previously. She could begin some exercise. She had moderate improvements in her pain, which I've seen using this approach. She improved in her reports of rigidity in her movement patterns. She felt like her anxiety and concentration improved tremendously during the 6 months. And she was able to stop excessive snacking because she felt more satisfied. She felt more full and not as hungry, didn't have as many cravings for the processed foods and sugars. So based on my findings, the ketogenic diet was safe and effective for improving her biomarkers of health, her symptoms of depression, anxiety, and some of her Parkinson's symptoms. Of course, this was a case study, so I always recommend larger, more generalizable studies are conducted based on this research. So you know what my tips and takeaways would be. Try a ketogenic approach. Take your fats to 70% or even 60%. Take your proteins to 20-25%, and take your carbohydrates really low. Get rid of all the processed foods and sugars in your diet. No soda, no sugary drinks. Increase your healthy fats, including MCT oil, olive oil, beef tallow, lard, butter. Try testing your blood ketones and glucose every morning. That'll tell you truly what your body's doing with your nutrition. Try some intermittent fasting. Take your meals down to 2 meals a day. You've heard me talk about this before. Or occasionally just do 1 meal a day, a few times a month. Increase your exercise, even if it's just walking. Try walking 20 to 30 minutes every day. Start there. And get your labs tested. You can order your own labs if your doctor won't order them. So go back to my YouTube channel and see some of those lab series, the Blood Work 101, and I'll tell you some ideas about how you can get your own labs tested. You can order them yourself. So thanks for stopping in for another brief research review. This was the results of a ketogenic diet in one woman with Parkinson's, a case study. It was a 6-month study and she had some good results. Drop a comment below. Let me know if this was helpful. And I hope to see you on some of my future research reviews. Take care, everyone.